Swadikap, good afternoon. Once again, today is Tuesday, the 25th of May, 2021. I'll start off first with the number of cases that we have recorded for today. So we have 3,094 new recoveries reported for today. And we have new confirmed case at 3,226. Out of this number, 2,325 are from cases of local transmission, and 19 are from overseas infection, while 882 are from within the prisons and penitentiaries. The total cumulative number of active cases still being treated at the moment is 45,413, as you see on screen. We have 26 new fatalities, making the cumulative at 832. Now, Dr. Apisamai just now mentioned some important pieces of information regarding the situation in the provinces, various new clusters. For example, we had this morning the daily CCSA meeting wherein we had the video conference discussion with the governor or deputy governors of some provinces, important provinces, such as Pathum Thani, Nonthaburi, Samut Sakhon, and the like, regarding new clusters, the clusters that we are trying to contain in these various provinces. For example, the deputy governor of Pathum Thani province discussed with us regarding the new cluster in Air Market, Talat Air, wherein the active case finding mission has been concentrated there. Most recently, around 174 people had been tested in that market through active case finding, wherein it was found that 22 were positive. Aside from this, during this past week, Dr. Tuisin was in the provinces as well. The spokesperson was in the provinces, and he was inspecting the various measures and containment procedures in the province of Sisakhet. I'd just like to add that every day when we give the number of people coming in the country through the various flights, there are cases of people who have been infected before they arrive in Thailand, or when they arrive in Thailand and when they are within the state quarantine system. Now, just to note that the Royal Thai embassies and consulates, as well as the airlines, commercial airlines flying into Thailand, have been doing their utmost in terms of the strict measures and screening procedures. The embassies, for example, are very strict in terms of issuing the certificates of entry, or COEs, for foreign nationals who are permitted to enter Thailand, as well as for Thai nationals according to the measures that we have here in Thailand. Of course, as you know, there were 4 countries which the foreign nationals flying in from these 4 countries are still prohibited because of the new variant first found in India had been affecting these 4 countries. So the strict measures, of course, aside from this prohibition of foreign nationals traveling from 4 countries affected by the variant first found in India, aside from that, the strict measures include, of course, the testing of the PCR before flying in. Flying in, with the exception, of course, of Thai nationals are permitted to fly in, as well as other groups such as diplomats. So I'd like to talk a bit on an issue that was mentioned in the Thai edition as well, regarding the tightening of border control measures. The government having issued a standing order to all agencies involved to tighten the border control measures to stem the spread of COVID-19, especially the variants of concern. Now, for Border Patrol Police, these measures include increased frequency of border patrols, increased use of technical equipment such as drones, and establishment of more checkpoints. For the Ministry of Interior, this emphasis is on the increased vigilance in border provinces and strengthening of the punitive measures for people smuggling and illegal entry into the country. As you may have heard in our briefings and in the news, many illegal entries into the country through natural borders, meaning through mountains and riverways and the like from neighboring countries. So to this end, the Permanent Secretary of Interior had said that the participation of civil society and other sectors would support the operations of the officials, as well as in blocking the illegal migration through natural border crossings, and in enforcing disease control measures as well. So all provincial governors have urged the different sectors of society, civil society, to take part in this surveillance to prevent illegal border crossings in an effort to curb the spread of COVID coming in from other countries. Now, the sub-district and village headmen and members of the local administrative organizations have also been asked to assist officials at checkpoints and disease screening areas, as well as in various local communities. Factory owners have also been on board. They've also been requested to check the migrant workers and their workplaces frequently. Of course, they will also face legal action if found to have offered accommodation to migrant workers who have illegally entered the country through these border crossings. Now, just a little bit addition regarding the vaccination of expats residing in Thailand. As we had mentioned earlier, in the process of preparation right now, and for across the country, people living outside Bangkok in the provinces, when the mass inoculation begins, they are asked to be in contact with the local hospitals in the provinces where they have medical records, or at other health centers as designated by the Ministry of Public Health, to register their intention to receive the COVID-19 vaccination. So that would be for the hospitals in the provinces and across the country. Because I'm mentioning this because there still exist questions on social media regarding the registration. Now, in Bangkok in particular, aside from the hospitals that would be informed about this to receive the registration for vaccines for those who already have medical records, aside from these, as mentioned, there would be designated hospitals as well for expatriates, including in Bangkok, just as some examples, Vimut Hospital and Bang Rak hospitals and other facilities will be participating in this vaccination rollout, and will be announced later. The other venues will be announced later. But just as an early example is this hospital, as one of the hospitals designated for Bangkok. This is found in their Facebook page. And people expats can register their intention. And of course, as mentioned, the nationwide campaign will commence on the 7th of June 2021, and we'll have more information. So the widest number of hospitals, I don't have that yet, but it will include the hospitals around the country that will be informed about receiving registration for foreign nationals. All of this is by the 7th of June, so please be patient. Another issue is about the Social Security Office assuring employers covered under Section 33 of the Social Security Act that vaccinations will begin in June, and this will include foreign migrant workers as well under the Social Security scheme. So the Social Security Office had mentioned that over 80 contracted hospitals across the country are ready to provide this inoculation service for this particular group of Social Security card holders and foreign workers. The Social Security Office also said that the Prime Minister believes that Section 33 workers, mainly those who work in the offices and the driving force of the Thai economy, will be making use of this scheme. Many of now have high risk of contracting the virus, given the nature of their work, which often involves handling customers and meeting with people. Now, also the employees under Section 33 can register through their employers, who will forward their name to the health data to the SSO. So about 2 million employees under the Social Security scheme have registered to join the program so far. Another issue on field hospitals, there are enough beds in Bangkok to cope with the spike. In Bangkok and surrounding provinces, just a note that the deputy government spokesperson, Kun Rachada, said that as of earlier this week, around 61% of the beds at hospitals, field hospitals, and hospitals in the capital are occupied, 61%. And there remains bed available, while 39% of these beds in 12 health zones are occupied, and there are still around 24,786 still available. So since Greater Bangkok area continues to account more than half of the new cases nationwide, the number of beds in Busarakam Hospital will be increased. The Public Health Ministry is also working closely with private hospitals to find more beds for patients with serious symptoms. So this is the information that I recap for you for today. We started off with the provincial situation, and then when we have Dr. Tuisin back, perhaps tomorrow or later on this week, he might be talking about the inspection that he had in the provinces in the Isan region in more detail for those of you who are in that region of the country. He went in particular to inspect the province of Sisaket. So we'll have information on that for you in due course. So after my briefing, we will have a program with the Ministry of Public Health, senior officials, the Department of Medical Sciences, to talk about vaccines and anything interesting and important. We'll recap and let you know in due course throughout our briefings this week. Thank you very much for your attention. Have a pleasant week. สวัสดีครับ
กราบขอบ